It's not too bad. I got
Okay, we're recording now. Yeah. So hopefully the other student will join us soon. I have some videos I want to show you. So the lecture is about AI in dentistry. Let's see, I think this one. I think it doesn't have an audio here. All right. So this Capuno, it's from a German company, it's called Ivoclar, and have virtual reality teeth. You can show the patient before, and they choose, even the patient can choose the type of teeth they like.
Um,
Yes.
It's a video on interiors.
Yeah, no, it's a we know when we do wax up and show them when to wax up and show them before they do that, and we before even grinding the teeth we can do them the wax up and mock up and show them how it's going to be the teeth going to be. So this one Capuna. The other one is uh this one is better video. Let me show you this. It's a bigger version. Augmented reality feature of dentistry. And on tablet, we can show the patient. Yeah. That's a big marketing.
Yes.
Yeah, the patient will love that. And immediately they will pay whatever you want because they can show them before and after. Yes. And you design it. It's already designed, but you just make it, and there's a 3D printer. And
Are so cool.
yeah, so that's another thing. Big difference. That's
You get into that to like healthy TV.
yeah. So this is second opinion too. Oh, that's the audio. I don't know why the audio is not here. Because we have to remove the screen from the other screen anyway. Maybe let's see diagnostics. Diagnostics, it's more of it's an oral surgery. It can be diagnostic. It's all worked on the CT scan of oral facial CT, the dental scan, and we'll give you the diagnosis. This tooth has preapical infection. This one has an abscess, and the abscess communicated with the sinus, and we'll show you what is it. And I think I have it. The this the X-ray, 3D X-ray, and the head and neck with in dentistry we call cone beam CT scan, and it show you the tooth and give you the diagnosis. There's secondary caries, and let's see this one. This one doesn't have it. Can you see the teeth there are abnormal? This infected, and this teeth crowded. Yeah, there's yeah, yeah. So short filling, the filling is affected. Yeah, and I have another one. That's that's pure the second opinion. This one will show you there's a decay. Not this one. I don't know what is it. Let me stop sharing. Anyway, I have it in the pictures. So Okay. So AI in dentistry. Uh, so the future is AI. And you want to, if you don't want it, it's coming to you. It's coming to us. And remember the guy who gave us the 3D printer or 3D scanner? He wasn't dentist. He wasn't dental lab. I thought he's a dental lab technician, but he was not. He just computer guy. He's from Boston. He just like he got his accent, Massachusetts. So he got his accent, but he's a computer guy, and he talks about distal, mesial, floor of the mouth, and he learned this from the software. But I hate him when he can do the upper, can be in the lower, the maxilla doesn't have to be in the. I hate that because like or in the maxilla will be upper, the mandible will be lower. So but he's a computer guy. He doesn't care about that because the computer will know that's the maxilla and the mandible will be there. So
the scanner doesn't know which one is which.
No, the computer knows the upper maxilla, but in virtually, if you flip it, the computer still know that's a maxilla. That's the maxilla, that's the upper jaw, this is lower jaw. But for me, when I see it upside down, it doesn't work for me because I need to flip it back. And and the margin and the stuff, he had some difficulty learning about the anatomy, the small anatomy, about the grooves and the stuff, because he doesn't learn. He just knows the computer. He knows the occlusion would bite like that. But that's AI is gonna be like storm. I have this picture in 1966. Math teachers protest against calculator use. Yes. So they introduced calculator to the college, and the math teacher were upset. And the calculator, well, that's not a big deal. And now ChatGPT banned from Italy for the privacy concern. But there's Gemini, there's a Copilot, there's many. You can ban, right? No.
But they still say they're like your calculator is as smart as like the user.
Yes, but I know the calculator is you need a calculator, you need that. But the floodgate was open. You cannot stop it. Remember when last year, like 2 years ago, and Elon Musk and the other rich people, they said you cannot use it because it's gonna be disaster, because they've been used it since 2018. They have it, but now because OpenAI has become public and everybody can have an access to that, it was a big deal for them, and now now it's a big deal. But you like it or not, it's coming, and it's going to change the life, change everything. And so
people they start doing like singers.
Yeah, there's songs. Yeah, I sent you a song I made about. Do you remember the song I made them through it? Yeah, yeah. They made songs about teeth numbering and ethics, and it's songs through AI. So dentistry landscape is changing. It's evolving rapidly. And a long time ago, it's like this. Uh, it's nowadays everything digital. If you don't have it, you will be backward. And everything is fast, everything communicated, and it's a big deal. And sorry about the pictures. So I was learned in the 20th century. So we have a professor teacher teach us how to do this. He has experience. We give us that experience. Student become professor, become expert, become specialist. And we spent like 3 years residency, 2 years, 3 years master degree, 2 years for subspecialty. We spent all these years, have five medical degrees, and we spent a lot of time learning. And like I remember, I said, you can feel the tooth when the buccal blade gonna get fractured. There's an AI now called Deep Care. will show you this, the buccal plate gonna get fractured. Long time ago, we have to feel it. We have to feel buccal plate gonna fracture when you do extraction. Now, nowadays, there's an app will tell you, be careful, the buccal plate can be fractured when you do extraction. So that's what we learned. We learned it's a hard way, but we learn from our teachers, specialties, system effectiveness. So system was for many years, that's the system we used. But in the 21st century, the system is different. The system is now, it's a program. You need the cases. You need the specialists. You need the specialists had cases. There's a company in Germany that's I was reading about, Quanisit. They starting 2003, they bought about 300 dental magazine. And from 2014, 2018, they start labeling everything and upload it to cloud. The pictures, they have all these thousands of cases, picture of the tooth with abscess, and they write labeling. They start labeling. This tooth has an abscess on the buccal aspect. This tooth has an abscess that has a fracture on this side, and they upload it to the computer. This sinus is involved, has a cyst in the sinus. This is fracture. This is the margin is exposed. So they add this information and give it to the machine. The machine start learning thousands of information. That's called machine learning. Then artificial intelligence will organize that, kind of start knowing, oh, this is exposure margin. This is periodontal disease. This is bone loss. This is a decay. So, so the specialist, the thing within 5 years gonna replace us, hopefully replaced by you, but we will be replaced by somebody at least has went through the college. But anyway, so that's computer power. Computer power came and took stuff by. I have another slide about the machine learning. So the machine learning, data collection, that's a big deal. They collect data and they as I said, data collection. I know about that, but many companies, they did the same. They collect information. The recorded lectures, my recorded lectures, the college will sell them for money, and there's a company will decode these lecture, because Zoom lecture has even the word to change the audio to text and make it lecture. And there's the PowerPoint lectures all there. They can the computer will organize it, and they will learn from my lectures too, everybody's lecture, from YouTube lectures, and sometimes they don't have to pay for it. Yeah, and they will learn, and they get the information, and they put it into AI. Yes, so that's how they machine training the models. It will take years. They said the AI, the open AI, what they did takes them about many years to learn about the capital of France is Paris and the capital of Egypt is Cairo. But for many years they didn't know where's that, but the computer learning because of millions of information and labeling of pictures, labeling of information, it's become aware of that. If there's there's exposed margin, or there's decay, or there's inflammation of the gum. So AI can do the treatment planning. Treatment planning can be done. Critical rule designing. When we did remember when we designed we can design the implant, we can design the partial denture. Remember the distal extent, and we have the extra rest. Everything can be done by the computer now. AI driven. Invisalign is still use AI. Okay. Yeah. I know it's not comfortable. Yeah. Okay. Okay. So, so all these. So to play critical role, depends, and especially design crown bridge. Remember Anslow about how many teeth you need to do the bridge? It's built in. If you're missing two molars, or we're missing two molars, and we have wisdom tooth from here and one premolar from visual side, you cannot use one premolar. You have to use two premolars, because if you're missing two molars, that's a lot of pressure on the molar and on the third molar or premolar. So that's Anslow. So you add that in the AI, and the AI will design it. And design it, you have to take another one. If you have a curvature in the anterior, you have to think about the curvature of the crown and the bridge, how to do that. So surgical assistant, surgical guide, where's the nerve, where's the buccal plate, where's the thickest bone, where is the upper molar area, we have the sinuses, and we can do the surgical guide, and the AI will tell you the size of the implant, the length of the implant, and the width of the implant. All that can be done as a sort of we saw that Kapuna create. This is virtual augmented reality. In the college, they have this, the thing you wear it. Have you tried that? Augmented reality? They show us, like some courses, like firefighter, they train them with this virtual reality. So they don't get in, and they brought it, and I did the fire one, and I did to change the car, fix the car. So you don't have to fix a real car. Just wear this thing, and you read, and they give you two things in your hand, and when you move your hand, it's like you're moving something. And like if there's a tire, you move it or remove it. And if there's a fire, you find the fire extinguisher, and you aim it, and you move. It looks like crazy because you're wearing that, and you move in the. But this is the future of the training, the augmented reality. Anyway. Oh, in the office, you can nowadays, some offices, they send you, if you go to the dental office, they know where's your birthday, but they know your dog name, they know your mother name, and they can send you, how's your dog, whatever, I hope your mother fine, whatever, because they can be more personalized. And the billing, patient records, and schedule. And there's one AI for office management is a big deal. I want to show you this one. Prosthetic, it's a big deal. Prosthodontics, whether it's fixed or removable. And the 3D printer, 3D scanner is already have some AI. Now the AI is more advanced, of course, more advanced and have more choices. It helped the dentists, helped the prosthodontics. And most of prosthodontic, they do the digital now. Although some of them, they still have the old-fashioned way, take impression and send it back. But that's what reduce time, reduce the cost. But one of the big deal is prosthodontics change. Root canal, imaging. The imaging, I have a picture of with the root canal, you have to find the root canal, have the branches, if there's a fracture in the root. So some X-ray shows that, some X-ray doesn't, some X-ray will know, but the 3D X-ray eventually will show that. With AI, will design which curvature you use, which K-file with how to clean the root canal, which cement you're gonna use, and which procedure, how how big is the opening for your root canal, how much you remove for the cavity, and it's a big deal. And Periodontics, you can see the measurement. You can measurement how much bone be lost, and will give you immediately if there is a tilting, if there's, and because they upload on not only X-ray, they upload intraoral pictures. We can see the gingivitis, inflammation. You can see if there is ulcer, if there is any potential periodontitis, or and immediately you can. There's one one AI app for hygienists. Remember, hygienists can chart. This one with X-ray, it will give the chart immediately because of the X-ray will show how much you got, because you can combine the X-ray with the pictures and save the time for the charting. And it's one of these big deal. Or pathology. One of the big early thing is oral pathology. There's one for skin. There's an AI for skin cancer, and you go like you download the app, take a picture of your lesion, and the AI will tell you what is it, cancerous or not, what is it. So in oral pathology, they can combine. They have millions of pictures, millions of biopsies, millions of X-rays, and they have to be labeled the same, and they put them the information, and then the machine learning, whenever in the future you send them a picture, an X-ray or biopsy, will tell you the diagnosis, will help in the diagnosis. So it's one of the early thing, especially when, remember, we do the research about oral cancer, the HPV related oral cancer. It's usually very small, and it's in the back of the mouth and the tonsillar area. Sometimes it's not visible. So if you take a big one of the intraoral picture, it can be detected. It makes life easier, because most of HPV positive oral cancer, the early diagnosis by lymph node, when it's reached the lymph node. And it's a big deal now. Did you get the vaccine, HPV? You have to get it. You should get it. So 3D digital scanner, 3D printer, that's coming, because it already has AI, already has AI. So now you can augment it with the patient picture. Now we can ask, most of patients now, they have cameras. We can ask them all pictures. So when we have all pictures, we can upload them to AI, and with the patient lost their teeth, the AI will help us to find the vertical dimension of the patient, centric relation, occlusion. All these can be done. AI in oral surgery is a big deal. Oral surgery, whether it's oral and maxillofacial, because they have the TMJs, fractures can be diagnosed, can tell you if there's a fracture there, and can tell you how many plates you need, if you need the intraoral fixation, wiring the teeth or not. For implant is a big deal, because we can, as I said, we can find the size and width, the shape, location of that implant. And also it helps in design the surgical guide. And I can print this for you and just gonna go through it. Another thing with the AI, because it's a crazy and new thing, so there's always ethical and consideration. In America, we have the HIPAA, patient information, and you cannot share the patient name, you cannot share the patient pictures, and a big deal. Another thing, I have to tell the patient there is an AI in your diagnosis. There is some sort of machine learning. Yes, they're taking it. Yeah,
it helps.
It helps, but the scary part we don't know. Let's talk about the military. Yeah. So the future trend of AI is gonna take over the AI dentistry. The future trend is unimaginable, because in just a few years, I've seen all these AI programs. Imagine after like 3 or 4 years, what happened. In Colombia, they have they have a new camera. They put it in the on the dental chair. It will record the patient communication with the with the dentist and the professor with the dentist or the training student. It will record everything and upload it to AI. So the training within a few years, we don't need professor. We just need the student because the AI will become professor. So goodbye to me. So, so that's it. Another thing. This is, I want to show you this because we didn't have audio about it. This is Patterson. You know, Patterson is a big company here. Henry Schein, they have another thing. Yeah. So this one can diagnose there's a decay, would show immediately. Imagine immediately will show there's a decay, there's a gum recession, there's a calculus, real-time detection. There's the bone level, there's calculus, and need to be clean. You have to be deep cleaning. As you can compare AI to the dentist, it's almost as the knowledge as almost like the dentist. Like the blue is the dentist, the orange is the AI. So you could do immediately can color the tooth, and I'll show you this. You can know where's the dentin, enamel, the pulp. Immediately can show there's a fillings and caries detection, and show you how much caries. We have caries like 30% in dentin, 100% in just in enamel, because the treatment is different. Sometimes early lesion, you just need fluoride and cleaning and pressure, but if it's in dentin, you have to clean it. If you have marginal, if the margin is, there's a leak in the margin, notable margin discontinuity, you have to remove that and change it. And you can see the periodontal disease, the bone level. That's when add in charting. And I have another one, and you can find parabical radiolucency. Patient need to root canal when they have an abscess over the tip of the root. If there's a calculus. And this is Denti AI. This is used by a hygienist. This is auto chart. Yes, auto chart treatment, and even can suggest the treatment plan immediately. Yep. This is the one, DiagnoCat. DiagnoCat will find the tooth and tell you immediately 90%, 100%, or 44%, and tell you how much loss, bone loss, how much they have parabical radiolucency, 97%, and sign of communication with the maxillary sinus, that's 70%. It will show because it's had the 3D X-ray, and also non-dental finding. They can see there's an abscess inside the sinus because it's coming from this tooth. And overjet, that's another one. It's almost the same. They can see immediately. You can see there's calculus here. There's deviation of that. There's a cavity here. There's fillings. Yeah. It's absorbing. Looks like bone resorption. Yep. Yeah, bone resorption, and there's calculus there. This is overjet can use for endodontic for root canal. You can see if there's extra. Can you see these small canals? Cannot be seen by regular X-ray. And even with the 3D X-ray, the dentist, you cannot see them. So with the AI, can you see these small and you see the fillings, you can see the decay. Yep. So that nerve roots. Yeah, the nerve roots, yeah, extra. Yeah, these canals should be filled. Smallify is this is real time. It should wax up, show them the future filling or the future bridge or future denture, how it looks like. And also it will show there is displacement. It will choose the rotation of the crown, and it will guide the dentist's preparation of the tooth. Also, Smilify, one of these companies. So AI technology, Invisalign, of course. These are, I think I have 10 of them. I add them. The we have 3Shape scanner, and we have FarmVal for the 3D printer. Planmeca is more X-ray, but now they do have 3D X-ray. It's a Swiss or German company, I don't remember. Carestream Dental, Medit AI, never seen them. Kapuna, yeah. All these, I'll print these for you. You can search them. You can just go to their website and see the videos. Okay, AI changing dentistry, enhanced diagnosis treatment. We can workflow going to be faster, being confusing. You can work from home. You can send your scan to the 3D printing company in California, and they will ship it to you. They ship the crown for you, and for surgery, the surgical guide. No one do. And most people they do implant long time ago. They do with a surgical guide now because it's cheaper now. Surgical guide is available. It helps a lot. It save you time and give you peace of mind. Patient center care. But when the patients see these, the future teeth, they will love it. So the future is bright with this. Any question? No.
Since during COVID, it wasn't much of a difficulty getting attention with all that.
Yep. Let me see. Okay. All right. Okay, guys. So that's it.